Thank you for that presentation. I really like what the Democracy Collaborative is doing as an individual. And what I wanted to ask you is a topic we discussed earlier this morning. As these anchor institution efforts are taking place and wealth is being brought to the community and community is improving, what have been your observations about issues of gentrification and displacement, as a result of improvements?
I mean, I think it's definitely a significant concern in, if you, stepping aside from health systems investments, what is often seen as one of the first anchor efforts to kind of deploy its resources and assets in a local community is the University of Pennsylvania in West Philadelphia. Arguably, there has been a lot of gentrification that has occurred in that community, and the former president of the university would have said that if we could do it again, we would have planned for success. And I think that is something that needs to be thought of in these different interventions, that if you're going to drive a lot of resources into a community, or even a few resources but in a dedicated way over a period of time, you have to assume you're going to see some change, and that change comes with it unintended consequences, especially if the benefits of those resources are not being accrued equally. And so I think the reason I held up the model of the community land trust is because it's a way of trying to get at that issue of being priced out that often happens as probably the main issue of gentrification, is that people can't afford to live in that community anymore. So if housing is a basic need, it's a determinant of health, especially since I didn't put up those numbers, but the amount, HUD often says that, one of our indicators on the dashboard is HUD, the Housing and Urban Development Agency, often says that individuals should not be paying more than 30% of their income in housing. I think today the number is a significant portion of Americans are paying over 50%. It's unbelievable. And so there needs to be a concerted effort to address that. And we think if you're going to make those investments, it should be done in the most thoughtful way possible. And we think a community land trust model is one that actually has a lot of potential. In addition to, obviously, it's one step in that process to allow people to go from rental to permanent, affordable, to permanent housing. So there haven't been a lot of investments by anchors in community land trust. I think Mayo Clinic might be the only one. So.
David, this is Bashara right here. Just two quick questions. One, does the Democracy Collaborative, are you guys looking at the definition used by IRS on community benefit that really limits what can and can't be counted as community benefit? So most of the stuff that you've mentioned, really health systems will not be able to count as community benefit on their 990. And then the other question is, these are great models that you've mentioned, and us at Trinity Health, we're very interested in this as well. We've just announced an $80 million investment into communities looking at these upstream interventions. But how do you really know that this is making a difference when it comes to health equity? And clearly our task as a committee is identifying those strategies that will make a difference. So how do you know that these efforts will make a difference when it comes to health equity?
It's a great question. For the first part, I would say that what can be counted as community benefit, I think, is much broader than what many health systems are interpreting. Now, do I think that spending locally or hiring locally in and of itself can be counted as community benefit? No. But do I think an investment in a workforce intermediary, or do I think an investment in a technical assistant provider for local business can be counted as community benefit? Yes, especially if your community health needs assessment or a local government says that's a critical need. So I do think that there is some demonstration of kind of the risk aversion of health care in what they're willing to count as community benefit. But if we're talking about it being the mission of an organization to benefit the health of the community, then it really shouldn't even matter what counts as community benefit. Unless, right, there's I think a larger argument to be made to both the stakeholders internally and externally that healthcare has, including local government or state government, which I think historically might be asking, why are you investing in housing when you should just be doing charity care, right? They do. I think there's a larger education that needs to be made. For us at the Collaborative, we're very focused on jobs and we're focused on wealth. So we think that those are important indicators of well-being. We don't think they're the only indicators of well-being. I think the last presenter very well talked about that. But we think that they're critical. And I think that in and of themselves, measuring good jobs created and measuring wealth over a long period of time within a specific community that has not had those opportunities is significant. If it is believed that having a good job and reducing the stressors that come along with economic uncertainty impacts health, and I think there's a lot of research that shows that economic conditions are a significant driver of health outcomes. Now, if you're going to try and create a perfect logic model, I think you run into some challenges, especially the further upstream you go. But you could also think about if you were to take on some of these issues, perhaps local hiring, or think about your investments in a community as, and I think Trinity is trying to do this with let's layer our investments, right? So if you're going to try and redirect purchasing or hiring to a specific neighborhood or community, and then you also layer on your more traditional healthy behaviors interventions, then I think you can then begin to see the overall impact of really addressing the full spectrum of social determinants. But that's going to take time. And I think that's one of the other really big things is that the further upstream you go, the more time it's going to take to really see the impacts of those changes. And so our hope with the dashboard really is that these are things we just want to simply put on the agenda of institutions, that these are areas where you can have an impact, but there isn't going to be changes in policies and practice unless people actually even understand what they're doing in the first place.
I thought it might be useful for the group to hear just a little bit about the dashboard and how it is based on social determinants of health and the number of institutions that have signed up to kind of pilot it and track over time. I think that might be useful.
Sure, and we actually, interestingly enough, have had universities sign up to pilot our dashboard before health systems. So we do have a cohort of 5 universities that, I don't know if I can pull the dashboard back up, but that are committed to tracking their efforts in those different areas everywhere from purchasing to hiring to investment to, I think, more traditional areas of community engagement and healthy communities, et cetera. And it's, again, not to say that a health system or any one institution is going to change the conditions in a community by itself. And these are the broad categories, not the set of indicators, and we think institutions should obviously adapt this to meet their specific needs, but we're heavily focused on economic development, inclusive economic development, I should say, because without it, we don't think that you fully can get to those other pieces, and that it is, in particular, I think a lot of focus is often spent on education as the silver bullet or panacea for addressing many of these gaps, but there is a significant need for working in the communities as they are today, and recognizing that education is going to leave a lot of people out if it ignores many of those that are well beyond having the opportunity to go back for traditional education in those communities. Yeah.
David, are the specific metrics on the website, I'm assuming, the actual specific indicators?
Yeah, and so this was developed through a significant set of interviews with leaders from anchors as well as community-based organizations. And so it definitely includes the input of a diverse set of stakeholders that we think could speak well from their long experience in terms of what really represents a healthy community and what would actually help to get there. That said, the proposed indicators are definitely ones that we kind of lean towards areas that were more easily able to be measured. And it's not, again, a perfect logic model. It's the sense of we believe that unemployment is a significant issue in our community, and we can see that, there was a recent article a couple weeks ago in the New York Times that talked about how many of our neighborhoods are a tale of two economies, two nations. Neighborhoods with a specific set of resources and assets have bounced back really well from the recession, and others have gotten worse, significantly worse. And the set of unemployment is up, and so if we're not focused on those neighborhoods and actually trying to address the conditions in them, then we're kind of losing sight of what our challenges are. So.
I'm a little confused by the term democracy collaborative when you're talking really not about power, but about local economic development strategies.
Great question.
I won't repeat that, but
Yeah.
to illustrate it a little further, if the goal is really, you started with economic concentration, wealth concentration, and here you're talking about organizing sticky capital when the rest of the world is going to global capital. I understand the power of anchor institutions, and hospitals are clearly a good example of that. But I'm not sure this is a way of addressing the concentration of capital that with the TPP and other political strategies are moving toward more global capital and at the expense of inequality at the community level.
Yeah, I think that's a very fair comment, and I guess the response that we take is, and the quick note on our name is partially based on the fact that if we want to have a strong political democracy, we believe that we need greater economic democracy. That without people having a vested interest in our society, that we're not going to have a vibrant political discourse and civic engagement. So that there needs to be people really feeling like they have an economic interest. That being said, we're looking at ways to leverage the resources that are still stuck in place and maximize those impact, recognizing that many of the trends and forces, and some of them will require national policy change. But I think you have two approaches. One is that you can think of this as a way of allowing resources to continue to be concentrated in as they have been over the last 40 years, and then thinking about a way to redistribute those resources. Or you can think about mobilizing local economic assets differently to try and through the internalize many of those trends, right? So an employee-owned business is not going to vote to outsource its jobs out of the country, right? Its owners are rooted in that community. They have a set of values and they have a set of interests that are greater than bottom line. A community land, so let's take just quickly evergreen cooperatives. In theory, one of them is a commercial scale laundry, right? It does 10 million pounds of laundry for one of the hospitals. It could be bought out by a national competitor that still does the bulk of the laundry. But the nonprofit that it is a subsidiary of, this for-profit employee-owned business, the nonprofit has veto rights over that business moving out of the community, right? So it balances the tension, or the tension that those workers may benefit from being bought out by a large competitor, and they could really get a big benefit in wealth creation, but that defeats the purpose of investing in that neighborhood. And so I think of that in terms of we can subsidize our way of, bringing in a traditional grocer into a neighborhood, and the minute they think that the demand isn't there for their products, they're gonna leave. Or we can think about creating a cooperatively owned grocery store. I might be biased. I'm on the board of one whose owners are the members of that community. So that is kind of the shift in thinking of trying to reorient economic resources in a way that through the actual development of those businesses or those that ecosystem, they're more stuck in place.
David, I really admire what you're talking about, but I'm wondering why you don't include the responsibilities of companies that benefit in many ways from community resources or state resources or national resources. I don't know why you don't imply a responsibility for, pick any large Fortune 500, S&P 500, Dow 30 companies. They exist under our legal system. They benefit from federal courts. They benefit from national defense. They benefit from, frankly, the sacrifices of many millions of citizens, but you don't include them as having a sense of responsibility here. I would be interested to know what you think might be the agenda of social responsibility of any major U.S. company.
I do think they have a set of responsibility. I just think that if you think about this strategy, right, if you're redirecting local business from, if you're redirecting existing spend from a healthcare institution to the local economy, and obviously it's never good to have just, if you're a supplier of goods and service, you never just want one customer. But if you're basing that on the supply chain of a multinational company that really at the end of the day has no obligation to place and that can pick up and leave at any time.
That's actually my point, is that you're assuming they have no obligation of place, but they do have a dependency of state. That's another, I just suggest that. It's not a question, actually.
No, I think it's a fair point, and I do think that they should definitely be held to
the incorporation requirement. Any corporation, any company incorporated in the United States, when you look at their incorporation requirement, whether it's Delaware or any other state, they have an obligation. That's what the incorporation law says. They exist to benefit the state.
That's fair. I think that the fiduciary duty, though, of a nonprofit or public entity might be greater to the local community. And I guess if given priorities, we would say go where it's easier to begin to make an impact, considering the vast amount of resources flowing through these institutions. Not to say that traditional corporations don't have a responsibility. It has taken a different shape over at least the last 30 years, and the ability for them to be kept, or to, the story we often tell is Cleveland in the 1950s had the second most Fortune 500 companies out of any city in America. Now it has one. Exactly. So if we're going to invest our time and resources in community-based strategies, we think that it is more ripe to think about repurposing these resources, and hopefully then through civic leadership, you can bring along other private employers. And I think that's what Hopkins is trying to do. We'll see if they're successful, but they are trying to use their leadership now with Liv build and hire local to bring along Under Armour and other other companies in the community that are currently reside in Baltimore. Yeah, but it's a well articulated comment. Thank you.